Massachusetts lecture series. I'm Jayme Valdez and the owner of Clearview OCD Counseling. I'm a specialist in the treatment of obsessive-compulsive disorders and serve on the board of directors for OCD Massachusetts and OCD Rhode Island. OCD Massachusetts is a nonprofit affiliate of the International OCD Foundation, and we're very thrilled tonight to have Natasha Daniels with us. And we're also thrilled to be hosting our second lecture series of the month, or of the year rather. And tonight we're going to focus on how to help children and teens who are anxious or compulsive and are also struggling through a worldwide pandemic. It's a difficult balance to strike. We'll be exploring topics such as if a child has contamination OCD and is living through a pandemic that requires hand washing, how do you balance those two things? So in a weird way, this COVID pandemic has thrown down some roadblocks in our path. We're not able to hold our monthly lecture series in person, which we usually do with OCD Massachusetts in 3 different locations throughout Massachusetts. For OCD Rhode Island, we do it in 1 location. So there's 4 lecture series that are not happening in person, 4 support groups that are not happening in person. But this has also provided us with a little bit of a blessing in that we're able to reach a wider audience by doing this virtual format. And we're also able to welcome really cool guest speakers like Natasha tonight, who we otherwise wouldn't be able to fly out here and, have do our lecture series for us. So counting our blessings tonight, I want to welcome with me this evening Natasha Daniels, who is a child anxiety and OCD therapist. She's also a mom, as I am, to 3 kids. I only have 2, so she's got me on that one. And she's the author of Anxiety Sucks, a teen survival guide and how to parent your anxious toddler. Natasha's helped many, many families over 20 years and maintains her private practice, which is called Hill Child Counseling. She's also the creator of the site AT Parenting Survival, which is how I originally found her. So it's just the letters A and then T, Parenting Survival. A YouTube channel, Ask the Child Therapist, and the host of the AT Parenting Survival podcast, which I listen to routinely. Natasha offers parents worldwide resources on how to help kids with anxiety or obsessive compulsive disorders through her online AT Parenting Survival School. And her work has been featured in a lot of places, such as Huffington Post, Scary Mommy, Psych Central, the Child Mind Institute, and The Mighty. So without further ado, I am really excited to partner with you again, Natasha. We've partnered in the past, and this is going to be a cool topic tonight, I think. So thank you for joining us from afar. There's my dog Cricket chiming in. Is there anything that you want to add or talk about before I ask you any questions? And I think we might have some Q&As coming in through our live chat as you and I speak. And so I'll try to address those as they come in. So anyone listening live, please feel free to type in questions or comments, and Natasha and I will chime in on those. But anything that you want to add?
Yeah, I appreciate you having me. And I think this is the silver lining to COVID, is that we can collaborate, we can reach out, and we can talk about things across the country about stuff like this. So I appreciate you inviting me on.
Yeah, no, we are so excited. And it's kind of a golden opportunity. So I guess, as a clinician myself who works with, a lot of families and parents with OCD, anxiety, I'm wondering if you've seen any shift since about last January, February, March in your practice, like if you've seen COVID affect things in any way, and how you might have started to shift how you respond to families.
Yeah, it's a good question. I'm sure you're experiencing this too. Initially, I was surprised that I didn't see as much of an impact as I thought I would. So it was like this delayed reaction.
Yeah.
And I was like,
yeah.
why are my kids doing so well? You know, not to doubt their like resiliency, but I was like surprised at how well they were doing. They stayed in their lane. Their themes were the same. They're like, I don't worry about germs. I haven't worried about germs. And so initially I felt like kids were more resilient because they were used to dealing with uncertainty. They were used to dealing with these intrusive thoughts. And so their tolerance for these kind of struggles were actually, I would say, almost better than the average child. But as time has progressed, I have seen issues of contamination OCD and talking about what is normal, quote unquote, versus not normal. And I've seen a lot of harm OCD where kids are worried they're going to spread their germs. And there's like a legitimate component to these things. And so I'm sure this has happened in your practice too, where like I've had to like talk about the new normal, like what is normal hand washing now? And I was just talking to this girl the other day about how she decontaminates when she comes home. And the things that I was saying to her that were like, okay, were like things I would never give her my blessing for in the past.
Right.
So it's changing. I think it's changing that.
Yeah. And I think what you're saying echoes a lot of what I've been reading on a lot of the kind of OCD specialist forums and stuff, that I think we all almost got a little overconfident in the beginning because our clients were doing relatively well, and it was the general population that was struggling with COVID, and our clients were like staying on their typical OCD subtype themes. So COVID popped up, but if they had some other kind of harm intrusion or scrupulosity, that they stayed focused on their theme, and COVID didn't come in as I think many of us had expected and interrupted things. And that went on for a few months, and we were all like, yeah, we're doing a great job. And then all of a sudden, I think a lot of us specialists have seen a shift where we're seeing our clients shift too. And their theme seems to shift around the OCD topic. So if they had harm OCD before and it was about knives, for instance, now it's inadvertent or negligent harm OCD about giving COVID to my grandparents accidentally without me even knowing that I was a quiet spreader, for instance. So I think we're all kind of playing catch up and learning as we go. And it's interesting also to think about a year ago, last November, this was not a topic on the table. And, things that we're telling clients to do or are allowing clients to do, like wear masks or wash your hands, use hand sanitizer, are not things that we really would have been encouraging or allowing a year ago. So part of what you and I might discuss tonight is how we balance those things. I don't know if you have any thoughts off the bat about, like, say you have, a 9-year-old with contamination OCD who's doing a lot of hand washing, and it's to the point that they're rubbing skin raw. There's, open wounds. It's, interrupting their normal daily activities. They're not able to engage in life. But we also need to mitigate this virus and wash hands. How do you talk to families and also kids about proper pandemic hand washing versus compulsive hand washing?
Yeah, it's a good question. Because I think a lot of times even parents will say, and sometimes anxious parents will say, I want them to wash their hands. So I don't want them to not be cautious, or they have valid concerns. And so now what do I say to them? Because I'm worried too. And I don't want them to be doing exposures or not washing. We all need, and I've actually heard people say this, like, we all need to catch up to my child with OCD. And I think that's the wrong way to look at it. I think OCD will take something that is rational and it can still make something irrational out of even this rational pandemic. So it's defining those rules of when you come home and you have washed your hands once, and and some families are more extreme than others. So you also have to kind of like respect the family rules to some degree. But then when you're in your house, do you have to wash your hands every time you touch your nose? And so creating this bubble of safety inside the house. And I've had families where we write down the rules of like, this is when it's okay to wash your hands. And then this is when it's more OCD related. And those rules are changing, and how to wash your hands too. Writing those steps down. This is okay protocol of how to wash your hands. And this is OCD, and that will look different now than what it did before.
I think that's such a good point, that we're all kind of in this blind spot, where we're all learning as we go. And, I'm thinking about some families that I work with where we are doing kind of a top-down approach, where the parents are very, very anxious about the pandemic, but the children aren't necessarily, or their anxiety or OCD is presenting about a different topic than contamination, germs, or the pandemic. And one thing that we've learned over the course of the past 9 months, I'd say, is that this is primarily an airborne virus. I think in the beginning, many of us were like washing all of our broccoli and wiping down grocery bags and wiping down walls and not touching anything. And we've learned much more about the utility of wearing masks, and that while it may be useful in some instances to wipe down surfaces, we don't necessarily need to be as vigilant about it as perhaps we were 9 months ago. So there can be a very delicate balancing when you have parents who are quarantining everything in the garage, and are wiping everything down and are being hyper vigilant about surfaces. And then you have a child who is not necessarily very concerned about that. So I guess one question I have is, when you have very anxious parents who are hypervigilant and aren't responding to how data about the virus is progressing, how might you guide those parents to better help the children from that top-down approach, that we're helping the parents in order to help the children?
Yeah, I think it's super tricky, because it's not just anxious parents. I think, I went to the doctor today for a checkup, and it was like, clean pens, dirty pens, and I went to get my eyes checked the other day, and it took 20 minutes to get past the little, little gated area, because they had to wipe down everything. Even though I didn't touch anything, I was just standing there answering their questions. So it's being conveyed in public, this idea of like just making sure everything is overly cautious, making sure everything's wiped down. So I tend to not address that as far as the wipe down. I do have families I work with where there is like a quarantine period of time in their garage for 4 days. When they get their mail, they're wiping their groceries. But I still look for the OCD in those things. So for instance, with the person I was just talking about, just to use her as an example, that's an anxious family. They're all anxious. And some of it was reining in the parent, and having her participate in the session and saying, she has a lot of checking behavior. She doesn't know when to stop. And so we have to kind of model that for her, and coming up with family rules of what is, quasi-normal versus over the top. And and we would debate it together. Do you really need to take all your clothes off and throw them in the wash? And, or can she come in when they wanted to take her clothes off and put them in the wash? So then it's just like, does she have to rewash? That's a no. So I think it's dealing with both. So it's parentally not going around wiping things with Clorox. I've had parents do that, where they're continually wiping things down with Clorox and bleach, and saying privately, I think, to the parent, that's really scary for a child with OCD who has some contamination OCD or harm OCD, to see you wiping things down all the time, and getting some normalcy inside the house. I mean, I think that's where I start, at least.
And it sounds like there's a lot of negotiation that goes on, a lot of collaborative work, where you're trying to strike a balance between the family's needs and then also kind of clinical needs of how to balance fears with reality.
Yeah, because I mean, it's touchy, where you have to be respectful for people's level of anxiety around it. But then also not having a child decompensate because their world in their home, I really focus on their little bubble inside their house does not feel safe, that there's constant wiping and washing inside their home, and trying to reach that aspect of things.
And I think that is a good point to bring up, is that children do look to their parental figures or their primary caregivers for cues on how to respond to the world. What's safe, what's not, what's funny, what's not, what time do I go to bed? When do I eat? And our bubble used to be much bigger, where children would get these cues from a lot of other people, from teachers, from neighbors, from grandparents. And this bubble is very small now for many families, for many children. And so, I think that there is kind of this spotlight, I guess, on parents in a way that maybe there wasn't before, to kind of do this heavy lifting. And I feel for a lot of parents around this, that they're having to give the cues all the time about how the world works and how to respond to the world. And in many ways, a lot of it's uncertain at this time. And I guess that's our job as OCD specialists, is to help people live with the uncertainty around that. But there's less kind of outlets and less influences, I think, for children at this time. I don't know if you have anything to add on that.
And they're getting mixed messages because everyone's approaching this differently. So it's really confusing to kids. And I think that's why we have to be even kind of firmer in how we want to present it to our kids, so that they can be solid. I mean, the other day we had someone delivering something in our house, and my son was like wearing his mask and he had his hood up, and he has OCD. And at first I didn't know what he was doing. And I was like, you could take your mask off, you just got home or whatever. And he's like, I'm fine, I'm good. And I was like, are you worried about the guy at the door? And so I had to convey that he is safe. You are safe, take your mask off, lower your hood, like you are okay, so that he can have some normalcy and know, like, he can gauge what would be an appropriate response. And I think parentally, that's what we do, is we can ground our kids. Yes, the world is crazy and there's scary things happening out there, but there's also some safety here, and we can model that.
Great, thank you. So I guess let's start. I gathered some questions from families that my clinic works with and that OCD Massachusetts partners with, so I'm gonna just kind of throw a few of those at you, and I'll chime in too. But just from a basic level, let's say we're dealing with a child with contamination OCD, who pre-COVID was really worried about germs, contracting the flu or norovirus. And now this pandemic has hit, and the child is, very preoccupied with it, is persistently asking, what if I get sick? What if I get sick? Perhaps they're in a hybrid model or going to school full time, but they're attending school in person. Perhaps parents are still encouraging play dates or extracurricular activities, and the child is having school refusal or refusal to engage in social activities out of fear of getting contaminated. And again, there's a lot going on at home with, perhaps a lot of hand washing, a lot of reassurance seeking. How might your response be the same, given that they already had contamination OCD as a primary theme? And is there anything that might shift, given that we're in this pandemic with COVID?
I think we have to do some psych ed for our kids, because it's not just an intrusive thought. It's a reality, and so there has to be a conversation about it. So our typical response of, you may or may not get it, might have to be tweaked. I think we might have to do some education first to say, and it is a very OCD message still, though. We can only, we can't guarantee that we won't get sick. So this is, I think this is how we have to talk to our kids. Nobody can guarantee it. The likelihood you know, is, and it depends on your area, whether that's small or high, but most people are doing okay with it. So percentage wise, and this is, again, it's OCD world. It's sprinkling uncertainty and doubt, which is innately part of this pandemic for all of us, which I think is why people without OCD are having a harder time, you know, per se, initially, is because they're not used to dealing with that uncertainty. And I think also educating them on the precautions they're taking. And so with my 2 kids who have OCD, who didn't have problems in the beginning, very similar to like the clients I'm working with, they started to have issues because this is not their theme. But saying, you're wearing a mask, you know, you're doing what you can do, we're washing our hands, and that's all we have control over. And so we still have to live our life. We still have to see people. We still have to go and do certain things, especially at this point. And so I think it's having that educational piece. And then when it moves into OCD, it's that constant reassurance. It's that compulsive reassurance. And that's when you say, what do you need to tell yourself? Or we do what we can do, you know, and you give them that ambiguity again. But I think that psychoeducation is important.
Absolutely. Yeah. And I think that that's, you know, one of the toughest pieces about this pandemic is that we don't have all the data and we don't, you know all of the things. So some of the psychoeducation is flexing as we move along. And we're falling back on what we know, but also learning as we go. But it sounds like some of what you recommend is a focus on what I guess in acceptance and commitment therapy and ACT, we would call valued behavior. You know, we are still going to go to this, you know, small social gathering with masks on or whatever, because it's very important to us to stay in touch with friends or to see our grandparents or whatever the situation might be. That is very valuable to us. To maintain family connections, and we're doing it in the most reasonably safe way that we see possible. So it sounds like things are in many ways the same, but then some of what's different is that there's this lack of information, and also that we're allowing more of what we would have called safety behaviors or compulsions to exist, given that there is a legitimate risk out there with the virus.
Yeah, and I think it's to what level do you want to have those safety behaviors? And so, and I think it just goes to everything we're talking about is how far extreme does it get? Because a lot of times parents will say, yeah, well, you know, it's a pandemic, we're all kind of worried, but OCD will take it to a level that none of us are taking it, or not most of us are taking it. So there's always that, like, none of us like to throw up, you know, but if you have emetophobia, you are doing a lot more to prevent that from happening, and you're thinking about that a lot more, but none of us want that. I think the same thing with COVID. And we'll use my son as an example again. Like, he wanted to wear gloves when he went to school, you know, went to the grocery store, he wanted to like really suit up, you know, and we had a conversation about that's not going to protect you anyway. Like, really wearing gloves all the time, you still can touch your face. Like, it doesn't make any sense. And wearing a mask is good enough. In my family, in our values, like that's where we're at. And so I wasn't going to let him extend that, because that seemed more OCD related to me than what we were going to be doing as a family. So it's kind of reining that in a little bit.
Mm-hmm. Yeah. And I'm kind of thinking about some of my own work with families and children, and this is a little bit age dependent. You know, it's going to be different for a 4-year-old versus a 14-year-old, but in general, we often will say, I'm going to answer that one time with the factual information that I have, which is XYZ. So here's your psychoeducational answer for that question that you're asking. And then if the child keeps on asking for reassurance, then it's, well, I've answered this, and, you know, what do you think is a skill you could use? What do you think you should do about this? But not repeatedly answering or offering reassurance. And again, this is somewhat age dependent. You know, if you have a 4-year-old, they may not be comprehending this information in the same way that a high schooler might.
Yeah, definitely.
So thanks for all of that. So we kind of looked at a child who has pre-existing contamination OCD and is now living in a pandemic where there's potential real life risks. I want to move into, we know through studies that although it's often underreported, one of the most prevalent subtypes of OCD is harm OCD. And that can include thoughts of harming yourself, thoughts of harming other people. Those thoughts of harm can include acts of violence that are very grotesque, but they can also include acts of negligence, where maybe you're working in a science lab and you do the experiments wrong and you give people all the wrong test results. And now you just harmed all those people by giving them wrong medical results. I've been seeing a lot of this in my practice, this negligent harm OCD. Like, what if I'm a silent carrier of COVID and I don't, like, I'm asymptomatic, but I give it to my grandparents, and then they all die, or I'm the one person who brings it to my school. And I have no way of knowing. And all I want to do is get COVID tests all day, just so I know. So it goes back to the building blocks, like my fireplace behind me, like the building blocks of OCD are doubt and uncertainty, doubt and uncertainty. What if I have COVID and don't know it? What if I'm in that incubation period? And this feeds into that negligent harm concept. So how might you help a family or a child or a teen who's having intrusions that they might harm someone else? They really couldn't care less about themselves, but they're very worried that they might harm somebody else by spreading COVID.
Yeah, I'm seeing that a lot, as much as the contamination OCD, and with people who didn't have that theme before as well.
Yeah.
And I'm doing the psychoeducation first because I feel like we want to have a discussion about that. And I do that with kids in general, like one talk about psychoeducation, and then we're not going back to that just because now we're going to be into a reassurance loop. But, talking about the fact that we won't know, 50% of people, and I don't know about my data, but 50 plus people, 50% are asymptomatic. And so you won't know if you're carrying it, and you won't know if you infected people, and they won't know if it was you who infected them, because we just don't know. It's really an invisible disease for, to some degree. And so living with that doubt and uncertainty, and I talk about other family members might be bringing it in, or they might be doing this, or at school, it could be the boy, there's an incubation period. You won't know. So how do you live with that uncertainty? It's just like everything else that we've been talking about with OCD. So kind of then normalizing it. And then I do exposures. And so in the house, I will have them go and touch all the doorknobs, or the silverware, and safety-wise, I keep a cocoon to their home, and sometimes, make sure they've washed their hands or whatever, if they've just come from school. But for a child with harm OCD, that's still really scary, that you want me to go around, touch my nose and go and touch the doorknobs. And so exposures are not off the table just because of the pandemic.
That's a really good point. I think you made two really good points there. One is that as exposure therapists, we never actually assign something to a client that would potentially cause harm or death or illness, but we can simulate in many ways those experiences. And I almost think of it as a vehicle. I actually have my clients draw this out, where we draw out a destination, like an island or a campsite or something like that. And then we draw a road and we draw a river. And then over here, we draw some vehicles, a canoe, a car, and our destination, the island or the campsite, our destination is doubt and uncertainty. So we're trying to get there where we can live in this place of, I don't know if I've contaminated family members. I don't know if people might die because of me. And I have to live with that doubt and uncertainty. So that's our destination. Here's the road and the river that bring us there. But we have so many vehicles, canoes, cars, boats, anything, a bus, double decker. Those are the exposure activities. So those are licking your finger and touching a doorknob, or, walking outside when there's no one else around, but not wearing a mask. So they're low risk. We never assign things that are high risk for actual safety issues for clients, but they're the vehicle that bring us to this place of discomfort so that we can live with the uncertainty and the doubt. So I'm wondering if you can talk a little more about some of the vehicles that you use, which would be the exposure activities that you might assign to clients during a pandemic who either have harm OCD or contamination or emetophobia, things like that, to help bring them to this place of living with doubt and uncertainty.
Yeah, I like your vehicles. I like the canoe and the double-decker bus. I think visuals and metaphors are so good for kids.
Yeah.
We've done a lot of different stuff. I had, and it really depends on what that child's core fear and core theme is. So it's going to look different for each kid, depending on really what that is. I had one girl just had like intrusive thoughts about it. And so I like sticky notes, and we just wrote coronavirus all over her house. For harm OCD, I'm putting coronavirus here, I'm putting coronavirus there. I think the thing that a lot of times parents don't realize is in our rational mind, that seems not scary. And so it's like, well, I'm not going to have her write coronavirus here or there. Like, obviously she knows that it's a sticky note, but OCD doesn't really care about rational thoughts. That could be very scary. So it's going through with your child and saying, what number would that be? Like, how uncomfortable would that be for you to put that? So, that's a basic level, but I do a lot of touch this, touch that, prepare food for somebody. And then I like layering imaginal scripts where it's like, maybe I'm preparing your sandwich and I'm like, and I'm, putting a little coronavirus on here, and I'm sprinkling a little coronavirus here. And, here, I'm pretty sure you're gonna get coronavirus because I made the sandwich for you. So adding some scripting to it can be helpful. And then, for hand washing, and I think depending on the parents' level of anxiety, this can seem pretty extreme, and for others not at all, but I will do kind of a no hand washing zone at home. So, when you're home and you come to the grocery store, you've gone to school, depending on where you live, and you've washed your hands, depending on how severe it is, we might have you aren't going to wash your hands at all. You're only going to wash maybe before you eat. Not even when you go to the bathroom, or maybe only when you poop. Like, we'll come up with these restrictions and we'll do kind of a no hand washing zone at all, or we'll do incrementally that way. And some parents, they're very uncomfortable with that because they're like, well, that's gross, and it's like you have to swing all the way to the left to get back to center. So, those exposures those are on the table, because in our home environment, we can do those things in a safe way, or relatively safe way. Everything's relative, and make some progress.
Yeah. And I think that, it brings up a good point that if there's any clinicians out there listening, or parents who feel very comfortable, being at-home coaches, that we can get in the spot where we say vomit and poop and things, very easily, like these words kind of fall out of our mouths as exposure specialists. And we sometimes forget that they can be really jarring to other people. And I think the goal is to get people to a place where they can think or say anything. And really what we're focusing on is, what are you doing? What's your behavior? Is it avoidant? Is it aligned with your anxiety? Is it aligned with your guilt or shame? If yes, then that may be a problem. But being able to say things, being able to think things, those are not necessarily problems.
Yeah, and we don't want to create a bubble where we tiptoe and walk on eggshells for OCD. So if we're watching our language at home, or we're, being really cautious about those things, those are the first things you want to work on, so that OCD is not controlling the household.
Absolutely. And it's a very unfortunate example, but it is an example that I have that I bring up sometimes, is that I worked with a family once where the parents were sleeping in a tent in their front yard. OCD had taken over the household that much that the parents were paying the mortgage, but were sleeping in a tent on the front lawn because OCD wouldn't let them in their house. And it was a very sad situation that eventually got resolved, but and resolved very well. And now it's a much better functioning family where the parents are sleeping in their bedroom, but it can very much become a family disorder. And and it's sneaky. It's very sneaky.
It is sneaky.
So one thing that, I mean, I guess I haven't really come across it a lot yet. So I'd like to talk about it with you, is that for young children and even for teens, the idea of death is often a theme that comes up, whether or not you're on the obsessive compulsive spectrum, whether or not you're an anxious child. It's just a topic that often becomes interesting during those formative years. And now it's really a topic, given that there are families that are genuinely losing loved ones or people that they know, coworkers, cousins, or someone very, very close to them due to this pandemic. And I'm sure you, as I have worked with a number of children who obsess about death. I'm wondering if you have any resources related to helping families, like it might be a children's book or podcast or website or something related to helping families process loss and grief, because we have families who genuinely are experiencing that due to this pandemic.
Yeah, death is such a hard one because everyone approaches death in a different way, depending on their religious beliefs or their spiritual beliefs. And so I think it can get tricky. One that doesn't really touch on any of that, and I forgot what it's called because I'm terrible with titles. Freddie the Leaf. Do you know what I'm talking about? Freddie the Leaf.
That one.
Okay.
I know Badger's Parting Gifts. I love Badger's Parting Gifts, but
I don't know that one.
People can Google all of these and try to find whatever books you and I are talking about.
Yeah, Freddie the Leaf. I think Freddie with an IE, but it talks about the life cycle of the leaf and Freddie. And so I like that as far as like a generic, non-faith-based book as far as the cycle of life and death. Also, I think What is Death? And I forgot who wrote that. He writes really good books. He writes like what is death? What is money? What is God? He just writes like these really general books, and his book is also really good educationally. But I do want to say that I find that even with death, when you explore what the core fear is, it's different for each kid. So I don't even jump into helping normalize death or helping them understand that that we all live with the uncertainty of death. I mean, we get there, but first I want to know, what does that mean to them? Because I find that for some kids, it's who's going to take care of me? Where will I be if you die? And other kids are, what if I die? It's going to be painful, or I'm going to miss you. And so there are core fears underneath death. I mean, even though it's obviously a very common thing to be nervous about. So you'd want to explore that with your child. What's the scariest part about death for you? What does that mean for you? Because if it's who's going to take care of me, I've had a lot of people in my office where we've actually talked about, we have a will, and Aunt Jane is actually supposed to take care of you, which sounds like a very dark topic and probably not something that you would think is very therapeutic. But for that child whose main worry was who's going to take care of me, it was very comforting. So I would say start with that. And then death is a hard one as far as giving general advice, because I think when people have faith-based philosophies, they tap into that and they talk about their belief system. And when they don't, they have to have a different conversation with their child. So it like branches off in lots of different ways. But then we want to normalize it that, yes, there is COVID and people are dying. And so we're hearing about death a lot. But again, we want to look at statistically, what does that look like for the older child who is, science oriented or math oriented? What's the likelihood? We live with doubt and uncertainty. We're taking steps, but, this is a percentage. And if their focus is on them, then we talk about kids and how they're doing. But there's no beautiful answer, obviously.
Well, but this is one of the reasons why I love partnering with you on occasional projects, is that you're so sensitive to the different kinds of families that are out there. Like, you don't just have one vision of what a family is or what a family's belief system might be. And I just really appreciate that you incorporate all different kinds of families, belief systems, makeups, you know, I think there's a wide variety out there. So one thing I wanted to go over, because this is another thing that I'm seeing a lot in my practice, is that with the pandemic coming in, children, because they're looking to their parents for how to operate in the world, you know, again, what's safe, what's funny, what time do I go to bed, what do I eat, like how do I talk to people? They are constantly looking outside of themselves for these reference points. They then become preoccupied with the parent's safety. And this may overlap a little with the negligent harm OCD, but it's also this hyper vigilant preoccupation of don't leave the house. Are you wearing a mask? Are you hand washing? Do you have hand sanitizer in your bag? I don't want you to go. I don't want you to go. And 9 months ago, they would have let this parent come and go freely. I have cases where the child is dictating what time the parents can go to bed, if they can go to bed, you know, things like that. And so I'm wondering, you know, how you might help a family where the child is very, very preoccupied with their parents' movements, almost watching them minute by minute. Because I don't know about you, but I'm seeing a lot of this.
Yeah. And even, you know, especially I think in separation anxiety, where maybe there was already a little bit of a foundational concern about the parent safety, definitely an uptick in that. And I think it goes back to, again, answering one time, you know, I'm taking care of myself. I wear my mask. These are the things that are important to me, you know, to make sure I'm wearing a mask or to wash my hands. But I'm in control over me and you're in control over yourself. And I will take care of myself. I always like to use the language like, I've been alive for like 35 years before you were born or however, and I did really well up till then, and I'm going to continue to do well. You're not here to protect me. That's not your job. And so I think it's just putting them back into their child role and then not answering, because when we do answer, we're giving it validity. We're saying that I need to inform you of this so that you have to keep track. And so even though it will cause initial distress to say, I got me, don't worry about it. You know, you answer it and then you say, and I always like to partner with kids and say, look, from now on, I'm not going to answer you because that's just going to grow your O cloud or whatever you call it. You know, it's just going to grow it because you're not supposed to worry about me. That's my job. And so when you are, that's just feeding your O cloud. So from now on, I'm going to just say, I got me. And that's always going to be my answer. So that you're not frustrating them, although they will probably get upset anyway. And when they do, you just say, I got me. And then I find that kids will eventually stop asking because it's a bit annoying when you're like, I got me. They're like, you're just going to say
that day. Yeah.
Yeah.
So, you know, I guess from a clinical perspective, just to help educate parents or any clinicians out there listening, some of what you're referring to is a form of selective attention, that we choose to pay attention to the behaviors that we would like to see more of, and we ignore or give less attention to the behaviors that we want to see less of. And so we might answer this one time with psychoeducational information that's fact-based as best as we know at this time, and inform the child or teen, I'm answering this one time, and then you have the information. If you ask again after that, it's reassurance seeking, and I'm not going to reinforce that because it basically shines a spotlight on the fear, and this fear might be a false alarm, or even if it's a real alarm because of the pandemic, it's too loud of an alarm and it's going off too often and it's too loud, and we need to set it aside and keep focusing on our valued behavior, our schedule for the day, or whatever is right in front of us. And so one thing that, you know, I've been doing a lot more of with my family work is the selective attention concept of a big OCD shrug. It's the first skill you're taught as an OCD therapist is how to go, I don't know. Do you have COVID or not? I'm not sure. I don't know. Will you harm your family members? I don't know. Maybe, maybe not. It's this big giant shrug where you leave the client as difficult as it is to sit with and experience the uncertainty and doubt and any body sensations that come up with that, any thoughts that come up with that. And so I literally have parents who are standing in there in the kitchen trying to cook dinner, and their child is coming in and repeatedly asking for reassurance. And the parent is either shrugging or just ignoring until that dies down and the child moves on to something else, because that fear is not important. It's not getting attention anymore. Whereas if the parent stopped cooking dinner, stopped chopping vegetables, and turned every time to the child and answered over and over and over with reassurance, then we're giving this a lot of importance and saying, COVID dominates our house. This is a very important subject to us. This is a very, very big threat in our household. And it may or may not be. As you said, there's still a lot out there that we don't have clarity on. And what we can focus on is right there in that moment. Everybody in the household is okay and doing their homework, cooking dinner. We are focusing on the here and now. So I don't know if you have anything that you wanted to bookend that with, or.
Yeah, and I think that's great. And I mean, sometimes I have parents who will say, like, we're just not there yet. It's too much to pull back. And, creating reassurance cards is really helpful. And so, and naming it, whatever your child's struggle is, like COVID feeding, or I try to name them kind of funny things, like I want to grow my OCD card, and then you just say, like, you can have
cards. I'm not sure that all people listening will know what these cards are. And
so it's just an idea of making like almost like a card that says I can ask a reassurance. So if I have 5 of these cards, I can ask you for reassurance 5 times. And so it's helping a child kind of learn how to acclimate to not getting that reassurance, doing that OCD loop. So when you feel like that all or nothing is too big of a step for your child, you can make these cards up, just be cute, print them out, name them whatever you want, make them little squares, because you want the concrete thing, because that really helps solidify, I'm using one of my cards. I need to know if I have COVID. I have 5 cards, and you and your child partner and you come up with, what's the amount of cards you think that you can manage? Okay, well, I think I need 5 of them. Okay, and then maybe in 2 days, we're gonna go down to 4. And then maybe we're gonna go down to 3. And if you only use 4 out of your 5 cards, you can earn blah, blah, blah. Some bravery prizes or something. I like to celebrate and gamify things. So I might just use a card and say, I need to know if I have COVID. Here's a card. My mom, okay, give me one of your, I'm going to grow my OCD cards, or name it whatever you want. And it helps kids to really think about whether they want to use those cards or not. Do I really want to use one? I only have 5. Is it this important, or can I delay it? Can I ignore it? So we're building those muscles. And then they're physically seeing how much they're doing it. So that's a nice baby step.
Yeah. And I love this idea of, we aren't any better than the OCD if we're only black and white with the treatment. So I love these nuanced approaches. There's not always families who are going to be comfortable just going from only providing reassurance to all selective attention, or, they might need something in between, or the parents might be ready for it, but the child might not be. And so having these strategies where you can meet in the middle and then kind of work your way toward a more functional approach is great to plug on here.
Yeah.
So perhaps an expert level question, but one that's important is, what if you have a child, or, often I think a teenager who is not ready for treatment, is not interested in it, or perhaps thinks that OCD is their friend or an asset, thinks that it's protecting them? Like, why would I give up my obsessive thinking about this and my compulsive hand washing? Like, I'm staying safe from a pandemic at this time. I'm keeping everyone around me safe. But the parents are struggling and feel imprisoned in their own household. How might you support a family like this, where the child's not ready for treatment and is unwilling, but the parents are ready?
I really like the SPACE program by Ellie Leibovitz. I think that learning a framework of what you do for your child's OCD and what accommodations you're doing and how to pull back. a lot of times I think we don't realize how much we're doing to create and foster that environment until you look at it. And I know I have 2 kids with OCD, and a lot of times I'm like, oh my gosh, I'm doing this. And like, I didn't even realize I was doing it. You know, I was actually just thinking about that the other day.
That it's what a good parent does. I mean, a good mama reassures her baby. A good mama tells her baby it's going to be okay. A good dad says, I got this, you know. And so all parents who come to us who are struggling because they've been compulsing on their child's behalf are parents who have been doing what they should have been doing. It's just not what works for OCD.
Yeah, and it is sneaky. And so there are things like even going on in my house where I'm like, I actually just had this epiphany today where I was like, my son always has to get like ice cubes, not ice cubes, but, you know, like ice packs to go to bed. And I just thought, you know, what a very cool, like out of the box thought, you know, he's hot. And then I was like, I had this thought like, wait, he used to have like this intrusive thought that he was like going to die of heat stroke. And I'm like, I think that's actually, that's a compulsion. So we don't know, you know, until we dive into it.
On with my child who is having some obsessive compulsive spectrum stuff where he kept going upstairs to use the restroom. And I was like, what a great form of exercise. Like, I'm so proud of him for walking up the stairs instead of just being lazy and using the first floor bathroom. And then I started to realize, no, he's doing that because it's the cleaner bathroom, you know?
Yeah. So you don't know. So I think if you have a child who's not motivated, I think that you can work on your stuff. Look at Ellie Leibowitz's space program. He has a book out. He has one coming out, I think, in January that will be a little bit more parent friendly. But then also trying to help your child see, you know, doing the ACT approach. I think sometimes getting an ACT workbook or having them read something to get them to see not just ERP, but what are some things that I value that I'm not able to do anymore because I'm busy keeping track of where the germs are going, or my friends that I'm avoiding. You know, my friends are getting together outside at a park and I can't go because I'm too worried. So I think trying to tap into that, or even having them read stuff. I've had people read, teenagers read like Everything is an Emergency, the new graphic novel that came out. So if they're not willing to actively work on their OCD, are they willing to like passively digest some things that might give them some perspective?
And a really good way to get children and teens to read something is to put it in your bedroom or your office space and set it out. And then they think that it's kind of this forbidden material, but really, and so they might start flipping through it, but really you're wanting them to, rather than like assigning it or saying like, you have to read this. It's kind of like, well, I'm interested in this as a parent. And they're like, well, why is my parent reading this? And so they start reading it.
Yeah.
So we're pretty much out of time. I did just want to plug on that last piece that I think parent coaching with an OCD or anxiety specialist can be really beneficial to parents, even if the child or teen or young adult, dependent adult is not quite ready. There's ways that a specialist can help you start to put environmental contingencies in place that will better support the family and encourage change, even if somebody's not quite ready for it. And not all OCD and anxiety specialists offer this, but it's certainly something that you could reach out for and ask if somebody offers this service where they would meet with you, even if the identified patient, as we would say, is not quite ready for treatment. And I also just want to emphasize that readiness exists on a spectrum as everything else does. It's not an either or thing. People aren't ready or they're not. They're always existing on this spectrum of kind of ready, kind of not, somewhat ready, a little ready, like, and they're always moving up and down through that. So since we're out of time, I just going to wrap up with a couple thoughts. One is that we do have a goals group tonight. It's starting meeting right now. From 8 to 9:30, and Nathaniel has graciously put the link for us in the chat box if anybody needs it. Natasha, I want to thank you so much for joining us tonight as a guest from across the country. Again, it's one of the few blessings that COVID grants us, is that we can partner and hear from experts like yourself, and get some different perspectives, whereas we couldn't do this with our in-person lecture series. And I hope that this webinar is able to reach more people as a result. And I just really, really deeply want to thank you for taking time out of your schedule to help so many families out here on the East Coast.
Oh, my pleasure. Thanks for